The Nurse Navigator program is a program that has been supported across the state of Queensland, supporting our patients and our consumers who have complex care needs. The Nurse Navigator themselves are advanced practice nurses and midwives that support the patient through effective care coordination and care planning. Their main role is to enable the patient to understand the system, to ensure that they connect with the right caregivers and health professionals, to ensure that their illness and the way that they manage that themselves is lifted. So nurse navigation in general is about system knowledge. It's about ensuring access. It's having the clinical skills and the time to understand each individual patient. So this is where we pull forward, really focusing on patient-centred care. The component here is that each person needs to partner with them to develop a plan of care that addresses their specific needs and respects and values their time and circumstances. Nurses are directly involved in a way that is about managing the complex care needs, and here we are really focusing on achieving a reduction in fragmentation of the care. We're educating the patients to increase the health literacy of their own processes of their disease management, and also empowering the consumer and the carers to be able to be supported more at home and really move away from acute care reliance.
A new nursing system trialled at the University Hospital is being hailed as a major success. It helps local families who need it most.
Crystal Mako and her daughter Kiana Blessing are regular visitors to the hospital. Kiana has a rare condition, a disease which attacks her muscles.
I've never even knew anyone with a disability before, so she's opened my eyes to so much.
And opened a door to nurse Kelly Ince, who manages her treatment. Kiana needs so much care. She was placed in the new Nurse Navigator program in April.
I ring her for absolutely everything. I've got her number on speed dial.
Nurse Kelly helps coordinate routine appointments and takes control whenever Kiana needs emergency care.
I really just try to support Crystal make good health decisions for Kiana.
There are already 5 nurse navigators at the hospital. Next year there will be 10. In 3 years' time, 50 to help patients with complex needs.
It's going to make a world of difference to our community.
It already has for Crystal and Kiana. They recently took their first ever holiday, a 3-day adventure to the Sunshine Coast. It would never have happened without Nurse Kelly.
She's just been my right-hand man, go-to for everything.
The Queensland Government supported the Nurse Navigator program in one of their commitments. Our program's been going since 2015. 400 Nurse Navigators have been brought into the program across a 3 to 4 year period. That represents 1.1% of our nursing population here in Queensland. The navigation programs have nurses and midwives within them, and they are advanced practice nurses that bring to the forefront their system knowledge, their access and understanding of the different services across the whole of our state, and their advanced practice skills, their clinical skills, and the time that they give to understand each individual patient has been significant in this program. We cannot underestimate the impact that this program has had for that small investment impacting our large number of patients across the state.
I've been a Nurse Navigator since 2016, looking after complex chronic disease patients in the north of Metro North at the Caboolture Hospital.
And I've been working in the Nurse Navigator role since its inception too. In 2016 I started at Westmoreton as a paediatric Nurse Navigator and then moved to Children's Health Queensland to take up my current rural and remote role, partnering with patients from across the state. Nurse navigation is an amazing role. It actually helps the patients hugely. It improves their outcomes, it improves their experience, and also increases their access or decreases their access to the health system depending on where they're at in their health journey.
The patients that I've navigated over the past 3 years have been a very interesting cohort. They've been very clinically complex and also socially complex.
The benefit of the Nurse Navigator program to the patients is that it has improved patient wellbeing and quality of life. They understand that they have support systems, they understand how they can connect in a timely moment when they may have deterioration of their illness and be supported to be able to get early treatment to intercept that decline and ensure that they have got the support that they need from either treatment, counselling and or further education about their disease processes.
I'm Adele, this is Zayden. Zayden is 3.5 years old. Zayden has a rare genetic condition that is called GABRB2. At this stage there's about 18 of us in the world known. Zayden's been in and out of this hospital for the last 3.5 years. You feel very, very lost and you don't know who to ask, where to go, what to do. To have a person that you can aim any question at and know that any question is not a silly question, because your mind is so blurred that you can't remember what the doctor said when you walked out. So having that support and seeing where we've needed it over the last few years, it's been different. Every time we've been here, it's been quite different how we've needed support. Earlier on, it was a lot of emotional support, a lot of putting the pieces together to this puzzle that nobody had the answers to. I'm quite resourceful. I'm lucky, gets luckier than other people in that sense, but it would have been very, very difficult to even understand what he needed to do, who he needed to see, because quite often, whilst the doctors do try to work together as much as they can, each doctor sees one part of the child and they kind of help put it together as a whole package and make sure everything came together and everyone was looking at him as one child. Working with Shona for the 3 years, every time there's something new, she must have a magic beep on her computer that comes up, and she comes up and she explains to me every single part of what's going on. So I think that's the beauty of having a nurse that is so well versed in so many areas that she can explain clearly to me and in my time, because often when you've got the time with the doctor, they're gone and you still have questions. So it gives you a second chance to go back and ask those questions and have everything explained to you.
The benefit of the Nurse Navigator program to the system is that we are minimising duplication of care for that patient. We are increasing the confidence of patients to be able to come to our services and or be able to link with services from one part of the state to another with our health professionals to be able to understand where they need care provided, care planned, their treatment options, and also the confidence to be able to manage that in their homes closer to their families.
Our roles are very important, and certainly working in a rural and remote space, an example of how we're valued by the healthcare professionals is I had a call from a registrar at Goondiwindi Hospital about one of my patients from over the border, just wondering if I could do some linkage. So they could ring in so they could get linked with the health professionals at the tertiary centre to get the information they required to give them that care closer to home, and that's a huge value. And GPs often will ring to get information fed back, and that's them valuing that we're there and referring further patients onto us so that they've seen that we actually have had an impact and have had assisted them in the care of a particular patient, and getting those referrals moving forward, I think shows how we're valued within the health system greater than the acute setting and out into the community.
The Nurse Navigators themselves are demonstrating active achievement in advancing their professional context, their satisfaction in regards to being able to work to top of licence and to their full capability has been demonstrated in the qualitative research to date. What we're finding is increased personal reward and also the recognition of their organisations in the contribution that they make each and every day to lifting the patient's experience across our broad state, the state of Queensland.
Nurse navigation for me personally has really enlightened my understanding of the healthcare needs of our community, and for me I do get a satisfaction in seeing somebody rely less on the health service than ever before, and knowing that I've had a small part in that I've been able to transition them from really being so dependent on our health service to now being in their own homes and living their lives I had a patient actually within 2 years of seeing them has now, been on a cruise and spent some really good quality time. So for me as a health professional, and for me as a nurse, knowing that I could use my clinical experience and really impart that knowledge and actually guide them with their care and have enough voice to speak up, to say this is what we need, and to make small changes. Every day I think we're making small changes to the systems that we work in. We are pushing that envelope. And for me, I think we've finally got a seat at that table to be able to say this is what a top-of-scope nurse can look like, and this is what we can do for your health service. The role has developed through evidence-based research. We have undertaken quality research that the consumer themselves have said that Nurse Navigations has made a difference to their lives through being able to have confidence that they have a network of healthcare professionals to rely on, and also a individual nurse navigator that knows their family situation, knows their economic and social context, and being able to support them and give them education advice of how they can better manage their care processes themselves. The quantitative data, we're working with our partner, the Central Queensland University, and here over a 2-year period we will be connecting with patients that have been navigated and the nurse navigators themselves to understand what are the components around reducing the cost of healthcare when patients are supported and they are navigated through the system, that they understand that they are supported with qualified nurses with advanced practice skills. We are wanting to understand from the research of how clinician experiences gives better quality of care. We're wanting to understand how the nurse navigation has supported and improved the patient experience and therefore improved health outcomes of those populations that have complex chronic diseases.